Thank you to the Social Innovation Forum, the Inspire Boston Funder Collaborative, and all of you who are here today. It's 1980, and we are the Love Bugs. Yours truly in the red dress, like all preschool classes, full of promise and potential. The following spring at our graduation, we interlaced fingers, rose and sang, "We are family," enunciating every syllable just as we had been taught. Because by this point, we were a family. It was my beloved preschool community and that led me to pediatrics and to Boston Medical Center's tradition of service as an anchor for community health. BMC recognized early on that context matters, that every child's health and well-being is strongly influenced by the families and communities in which they grow. Yes, it takes a village to raise a child, but it also takes a village to fail to protect and invest in a child's potential. Structural inequities are the root of many adversities that harm children's developing brains and bodies. So transforming outcomes for children requires changing systems. Did you know that in Massachusetts, 1 in 9 children is food insecure? 25,000 public students are homeless. Did you know that in 2014, we had the country's highest rate of reported child abuse and neglect? Not surprisingly, all of these factors worsen in neighborhoods with less economic resources. The problem is that medical practitioners, educators, social service providers, and community organizers typically work in silos. We know how to provide high quality healthcare and to provide a great preschool experience, but our silos make it nearly impossible to address systemic factors that undermine our well-intentioned efforts. So at Boston Medical Center, we asked a basic question. What would it look like for every child to have an opportunity to thrive in a healthy community? Vital Village Network grew out of these conversations. We took the bold step to develop leadership capabilities of community residents and enhance existing efforts, as well as to strengthen connections and alignment across sectors. Vital Village Network at Boston Medical Center is a collaborative that builds the capacity of communities to improve well-being for children and families through collaboration, research, data sharing, training, and advocacy. Think about it. In the United States last year spent $3.6 trillion on healthcare. But science tells us what contributes most to health is where we live, learn, work, and play. Here's how we change systems. It all starts with belonging. We take a collaborative approach to recognize what is already working within communities and to co-create solutions with community leaders. Next, we promote collective learning through partnerships, shared data, dashboards that strengthen accountability, and research to ask new questions. As the saying goes, what gets measured gets done. Having the facts on neighborhood access to food, school readiness, and enrollment in early childhood education allow us to track and to improve progress over time. Finally, we convene networks designed to enable cross-sector engagement. Through these networks, community leaders share resources, innovations that help drive systemic change. The result is nothing less than transformation for individuals, families, and communities with healthier outcomes from children. Of course, none of this happens overnight. It takes a village of collective activities working together for systemic change. And here's how. Giselle Cabrera joined our fellowship in community leadership and advocacy to become a family advocate for special needs education, the person she wished she had had to help her with her own children. She was paired with a mentor, connected to a partner organization, and became a leader for statewide bilingual parent trainings. Melody Cunningham joined our breastfeeding coalition, where she expanded her network, skills, and through workshops, volunteering, and mentoring. She's now a social entrepreneur providing lactation support to new parents. John King Jr. wanted to help other parents who also face child custody conflicts. Through social justice mediation program, he found the tools and the network of support to launch a family mediation business serving Boston's family court. Boston public school teacher Jeffrey Cipriani wanted to address the impact of trauma on his students' learning. He participated in our collaborative STRIVE program with the Child Witness to Violence Project, which stands for Supportive Trauma Interventions for Educators. And now he supports trauma-sensitive training for his colleagues. What these four leaders have in common is a lifetime of knowledge and wisdom to share, matched by a desire to serve. Vital Village's role is to provide advanced skills, tools, and connections, and a platform for greater community leadership. Moving beyond service delivery, we build sustainable capacity. Now, Vital Village is a small Boston-based network, but we are achieving impact on a local and national scale. Organizations across New England and across the country seek to emulate our collaborative leadership model. We've worked in more than 15 states and with over a dozen community coalitions. In 2019, we expanded partnerships, leadership development, impacting more than 2,800 children. We've had several independent evaluations that show our model works. Locally, more than 90% of partners report advanced trauma understanding, social emotional learning practices, leadership development, and data collaboration. Nationally, over an 18-month period, coalitions that worked with us reported increased racial equity practices by 65 to 75%. And over the past 7 years, we have raised and invested over $1 million in community social justice innovations, the innovators, and the collaborative learning, and stipending the champion leadership. COVID-19 pandemic has had a disproportionate impact on the communities we serve and on our partners, many of whom are essential workers. This makes our work even more vital. It's not that we don't know how to serve the community. BMC is already providing affordable housing and prescriptions for healthy food, but by working together, the natural next step is to partner with Vital Village to scale up these prescriptions for resilient communities that can remain resilient while socially distanced. Currently, our model costs about $400 per family annually. Adverse childhood experiences cost nearly $548 billion annually. We are an excellent return on investment. We are seeking a $1.5 million investment over the next 2 years so we can increase our staff, double our engagement of community leaders, double community service hours and volunteerism, serve many of the educators that we aren't able to serve with trauma-sensitive models now, and expand our service to more medical centers such as BMC, becoming a national thought partner for community hospital partnerships. For so long, we have focused on the resilient child, the love bug who made it. With your support, we can focus on resilient places. What would a just society look like for a child? A just society would provide equitable, flourishing opportunities so that all children can thrive. Thank you.